My name is Ann Pearson, and on behalf of Public Health Seattle and King County and our co-sponsors, Seattle Children's Hospital and the Childhood Obesity Prevention Center, I'd like to thank you for joining today's webinar. I think we're going to wait another minute or two before we get going just to make sure that everybody who's registered is able to sign up. So hang on for a minute or two and then we'll get started. While we're waiting for people to join, let me tell you just a couple of housekeeping things. You're able to participate in this by asking questions through the chat box that should be at the bottom of your panel. So if you do have questions as you hear information, feel free to type them in at the bottom and send them out. We're going to try and reserve about 10 to 15 minutes at the end of the presentation to ask the questions that you've sent through the chat box. I'm going to start now by introducing our panelists, and hopefully by the time I've finished my introductions, we will have everybody, all of who's registered, signed on. We have some really wonderful panelists who are joining us today. And first, we're going to be hearing from Dr. Jim Krieger. Dr. Krieger is Chief of the Chronic Disease and Injury Prevention Section of Public Health Seattle and King County. Dr. Krieger is going to be describing the health effects of sugary drink consumption, and will also tell us just how many sugary drinks we're consuming here in King County. Next, we're hearing from Dr. Lena Liu, who is a pediatrician with Odessa Brown Children's Clinic and also a professor at UW School of Medicine. Dr. Liu will be describing how and why Seattle Children's Hospital embarked upon Mission Nutrition, a program designed to increase the number of healthy food and beverage options at Seattle Children's Hospital. And our final panelist will be Jennifer Troup, who's the Associate Director of the Childhood Obesity Prevention Coalition. Ms. Troup will be talking about what you and your organization can do to create a healthy beverage environment. So without further ado, let me turn things over to Dr. Krieger.
Well, good afternoon, everybody, and thanks for joining us. And so I will get right started with the basics, which is, now it's not clicking again. You want to advance again?
Yeah.
Is starting at the beginning is what are sugary drinks, just so we all kind of on the same page about what we're talking about. And the simplest definition is any kind of beverage that has a caloric sweetener put in it, so something that adds sweetness and calories at the same time. So the first thing that I think of is sodas, but actually the market is growing, and a very important source of sugar-sweetened beverages right now, or sugary drinks, are things like energy drinks and sports drinks and fruit drinks, which have added sugar. And actually the consumption and production of the soda types of sugary drinks are declining, while the market share is increasing of these other drinks like sports drinks and energy drinks. So we're talking about the whole spectrum of sugary drinks when we're trying to figure out what we can do to look at their health effects and how to affect consumption of them. We call them sugary because it's simply that. They have a lot of sugar. So your average 20-ounce soda has about 6 teaspoons of sugar. That's about 1/3 of a cup. Putting that in perspective, that's about the same amount of sugar as in 6 Krispy Kreme donuts, and twice as much sugar as the Department of Agriculture recommends for your entire daily allowance of sugar, twice as much. And the bigger drinks obviously have a lot more. So if you get a 7-Eleven double gulp, that has 48 teaspoons of sugar. That's about a cup of sugar. Now, why are we concerned about sugar in particular? When you have sugar in sugary drinks, they tend to encourage consumption of large quantities of calories and sugar. They don't have any nutritional value. There's pretty convincing scientific evidence that drinking sugary drinks are linked to obesity and other bad health outcomes, which I'll get to later in this presentation. And also they have some pretty specific effects whereby when you drink sugar in liquid form, as liquid sugar, it bypasses the body's mechanisms that make us feel full. So you keep drinking and drinking without feeling full. So to put this in perspective, sugary drinks and soda are contributing about half of all the calories that are actually driving the current obesity epidemic. If you think about obesity as being caused by too many calories in and not enough calories out, it comes out to be about 300 to 400 calories a day, and sugary drinks are contributing half of that so-called energy gap.
Sorry about that.
Okay, no, it's working for me now or not. Nope. Okay, there we go. So when we look at where added sugars come from in our diet, to take a different look at this, we see that far and away soda, energy drinks, or sugary drinks are the biggest contributor, contributing 36% of all the added sugars in the diet. And then if you add the fruit drinks in, we're up to nearly half of all the sugars in our diet come from sugary drinks. Next one. So let's see what this means in the local context. Public Health Seattle King County just recently issued a report, which you can find on our website, which documents how much soda youth in King County are drinking. And nearly a third of the King County high school students report drinking at least one non-diet soda a day. And that's only soda. It doesn't take into account the other kind of sugary drinks like sports and energy drinks. About 8,000 of these students are drinking 2 or more sodas daily. So that's enough to drive the whole obesity epidemic right there. So if we dig down a little bit deeper, we can also see, and that's these bars that on the left-hand side of your screen, there are certain ethnic cultural groups among youth, high school youth in the county who are drinking more soda than others. So African Americans, American Indian Alaska Natives, Hispanic Latinas, and Pacific Islanders tend to drink more than whites and Asian students. And we also know that obesity rates are higher in these very, very same groups. So there's clearly an association there. We also know that among overweight and obese youth, they drink more soda, are high consumers of soda, almost twice as much compared to the healthy weight youth in our county. Well, and where are the kids drinking these drinks? Well, a lot of this consumption is actually taking place at school. So, and when you look at where kids get the drinks if they drink at school, by far the largest source is bringing them from home, but a big chunk, about 30%, are still being bought at school. So there's an opportunity to reduce consumption of these drinks for health reasons during the school day, both by what kids are bringing from home as well as what they're buying at school. A little bit more on what adults are doing in King County. Again, sugary drinks is something very common among adults. And what we find overall in King County is about 13% of adults drink a sugary drink every day, at least 30 of them a month. So a little bit different measure than we have for the kids because their data come from different sources. But, and again, there are clear differences in who's the heavy soda consumers in our county. Clearly, folks in low-income groups, if you look at that first set of bars on your picture there, those with less than 25,000 household income, 27% of folks in that income bracket or those households drink 30 or more a month, compared to less than half the percentage there among those who are higher income. Education also is a very strong predictor of who drinks lots of soda and sugary drinks. If you have less than a high school education or completed high school, 31% compared to those who have some college at least, only 9% are drinking a soda a day on the average. And again, certain ethnic groups also, whoops, you go back? A little bit back more. There we go. If you look on the ethnic groups, again, among adults, blacks and Latino Hispanic people are more likely to be heavy consumers as adults than whites or Asian Pacific Islanders who live here. So, it's not an equal opportunity problem, and it affects and causes obesity as in that context in these populations of low income, less educated, and minority people. So there's a clear health equity issue in who consumption of sugary drinks is affecting. Yep. Next one. Now, the reason we care so much about consumption of sugary drinks is because they have direct health effects. Obesity is our major public health crisis of the decade right now. And we know that 1 in 5 King County middle and high school youth are overweight or obese, and over half the adults in King County are overweight and obese. And because obesity in and of itself and also soda directly contribute to other health problems, this is becoming a major issue for us. So drinking soda directly can cause diabetes, can cause high blood pressure, can cause heart disease, can cause tooth decay, can cause arthritis and other problems. And we know that obesity also causes many of the same problems. So people who consume soda gain weight, and then if they continue to consume soda and are overweight or obese, they are having two major risk factors for developing these other kind of health conditions. We also know that the prevalence of obesity is rapidly increasing, and so it's doubled among adolescents and adults since the early 70s and tripled among kids in elementary school. We really need to turn this epidemic around, and if we were able to address the contribution that sugary drinks are making, we would probably be halfway there to solving the problem just by one single target and intervention. So that's why we're so concerned about sugary drinks at this point as a very important health risk. Next slide. But the good news is that we can actually do something about reducing consumption of sugary drinks. So some recent studies have just appeared, for example, in the New England Journal of Medicine, which were randomized controlled trials which showed that substituting non-sugary drinks, low-calorie drinks like water or non-fat milk, for sugary drinks would result in either decreased weight among younger kids or slowing the increase in weight gain among adolescents. So we know that there's hard evidence now from randomized trials even that show that cutting down consumption has important effects on weight. We also know that there are certain interventions that are likely to be effective in reducing consumption. And one of them, which we'll focus on today, is changing the environment, the availability of types of beverages where people live, work, learn, and play. And there's good evidence that if there is more availability of healthier beverages like milk, low-fat milk, water, and limited portion size of 100% fruit juices, and less of the sugary drinks, that people will buy healthier beverages. So we're going to talk a little bit about two great opportunities here in King County where people have been doing great work in their institutions to change the consumption and availability of sugary drinks. So the first one that we're going to hear about is a great effort at Children's Hospital, and Dr. Lena Liu is going to tell us about that next.
Thanks, Jim. That was a really fantastic background. So I'm going to take over the keyboard here and talk a little bit about what we've been doing at Seattle Children's. We've been doing healthy hospital work for a while, but within this past year, we decided to take a more concerted effort, particularly addressing sugar-sweetened beverages, and we called our project Mission Nutrition. And so I'm going to tell you about that right now. So you all know that childhood obesity has been increasing for several decades now. This graph just shows data from the 1960s up to the late 2007 or 8-ish, and you can see that childhood obesity rates have about tripled during this time in all age groups. When we look at data from within Seattle Children's, we find a similar thing, that approximately 30% of children nationally are overweight or obese. And when we look within our hospital at children who are coming into our subspecialty clinics, we see the same thing. So at the bottom of the slide here, you can see our different subspecialty clinics: pulmonology, nephrology, endocrinology. And then the blue bars are children who are overweight, and the red bars are children who are obese. And you can see if you add those together, you get about 30% of kids being in both categories, overweight or obese. So given that this is such a common issue, and as Dr. Krieger mentioned, the impact of sugar-sweetened beverages can be so large, we wanted to address this within our institution. I'm trying to get into the next slide. So we have an obesity program here, and I just wanted to give you a quick overview of the things that we do within our program. We actually cover 4 broad areas. We have clinical programs. We have a partnership with the YMCA called ACT, and we also have multidisciplinary wellness clinics where individual families can come for support. We have been doing education both for providers and for families. And in terms of providers, we've worked with the Department of Health to do quality improvement initiatives where we're working with clinics to get them up to speed on how to take care of and prevent obesity within their clinics. We also have been doing education for providers at our nutrition symposium, which happens every other year with a focus on obesity. We have been building our obesity research capacity here at Seattle Children's, looking at research both on treatment and in prevention. We've also taken advantage of policy changes that have happened locally. So for example, King County passed some menu labeling legislation a few years ago, and we took advantage of that to work with public health to look at the impact of that on family eating choices. And as mentioned earlier, we're doing advocacy and working with the statewide Childhood Obesity Prevention Coalition and have helped them hold policy summits. We're also working nationally with the Children's Hospital Association, which is CHA, which has gathered children's hospitals from across the country together to work on childhood obesity prevention and treatment. And one of our strong focuses within this initiative is to look at healthy hospital work. So there have been several other children's hospitals that have banned sugar-sweetened beverages. So part of our mission is to prevent, treat, and eliminate pediatric disease. And we really felt that as a children's hospital and as a healthcare institution, we should be modeling healthy behaviors for both our staff and for our families. So over the course of this year, with the support of some high-level administrative people who are really enthusiastic about this idea, we gathered leaders from our obesity program, from clinical nutrition, from dietary services, and from marketing and communications, and our main administrative people. And we decided to launch Mission Nutrition. Some of the things that we've already been doing here at Children's include addressing nutritional content for patients. We've actually been looking at patient menus for several years. We also had already been doing some work looking at our vending machines, so we tried to increase the percentage of healthy options within the vending machines. We had started out at about 10% and have now moved it up to over 40%. We've been posting stairwell prompts throughout the hospital for several years to try to encourage people to use the stairs instead of the elevators. At my clinic where I see patients, we have been working with a church across the street to build community gardens. We've also had a farmer's market here on campus at Children's. And with these efforts in place, we were recognized by the American Heart Association for having a gold standard rating for healthy hospitals. We've also been doing work with staff wellness in order to improve the health of our employees. We've been doing risk assessments that include issues around nutrition and activity, and we've been providing to staff interventions such as phone consultation and programs to keep them more active. And eventually we'll be building in financial incentives to improve people's health. So now focusing a little bit more on Mission Nutrition. Sorry, there's a little delay between clicking on slides. What we did was we gathered this sort of core group of people to work on Mission Nutrition, and we started out by making some phone calls to other hospitals and programs across the country that had already been making these changes. We wanted to learn how they did it, what were problems that they ran into, and sort of get really prepared for communication to the rest of our staff. The two areas we decided to focus on first were to look at healthier preparation methods. And in particular, we wanted to get rid of our deep fat fryer. And so to bake these options instead of having them fried. And then from the beverage standpoint, we decided to phase out the sugar-sweetened beverages for the reasons that Dr. Krieger had discussed earlier. The other third arm of Mission Nutrition that we felt was very important was to really improve our nutrition education. We wanted to have more nutritional content about the food that was being served in our cafeteria, have it posted online and potentially at point of purchase. We also wanted to better highlight healthier choices for families and staff, and put healthier choices at eye level. Eventually, we would really like to look at pricing issues to make sure that these healthier choices are similar or of less cost. So as we were thinking about making these changes, we wanted to make sure that we communicated with the right people. And before we go there, I'm going to talk about the particular changes that we made. So these are the beverages that we continue to serve in our cafeteria and in our vending machines. So we're continuing to serve 100% fruit juice with no added sweeteners. We've kept unflavored milk, all types of that, whole, 2%, and skim. We've kept flavored fat-free and 1% milk and soy milk for those who can't do dairy. And then the beverages that are available that don't have sugar in them include 0 to low calorie beverages. And we used King County Public Health's guidelines that recommended less than 10 calories per 8-ounce serving. We're also keeping diet beverages, flavored waters, carbonated waters, and unsweetened tea and coffee. So the things that we removed were sugar-sweetened beverages, those that exceeded 10 calories per 8-ounce, and these included, as you saw in the picture in the very beginning of the slide, sodas, sweetened teas, coffee drinks, lemonade, fruit drinks, sports drinks, energy drinks. And we also removed whole and 2% flavored milk. So we wanted to get some feedback from families and staff before we started doing this. So we met with our Patient and Family Advisory Council, and they were very supportive of the concept. Families definitely agreed that hospitals should be providing healthy and tasty food. One caution they mentioned to us when we talked to them was that when families are in the hospital, it can be one of the most stressful times of their lives. And they really talked about how during that degree of stress, they wanted comfort and they wanted things that made them feel better to deal with their stress. So we really took note of this comment and wanted in our communications with families to be able to address that issue of stress and how to deal with their stress with potentially different food choices and other ways to deal with stress. In addition to meeting with the advisory committee, we also surveyed families and sent out a sort of electronic survey to about 1,000 prospective families and current families. When we asked them about these changes, specifically this phasing out sugar-sweetened beverages and taking out the deep fat fryer, about 64% of families said that they would be more likely to visit the cafeteria based on these changes. 25% that these changes would not impact their decision to go to our cafeteria. 5% said they were less likely to go there, and 6% said they were not sure. So overwhelmingly, families were feeling like they would still be going to our cafeteria and were supportive of these changes. We then met with people within our hospital. We talked to leaders within the institution in the different departments. We developed an FAQ document. And prior to the changes in the vending and cafeteria, we launched this announcement on our internal website. This website allowed staff to comment, and we did have a record number of views for this change, sort of signifying that people really care about this issue very much. Post the launch, we are continuing to do communications with both staff and families. We plan to continue to update our internal website, and we also have an email address where people can give input. I'm happy to answer more questions about our specific effort later in this webinar, but I'm now going to turn it over to Jennifer Troup to tell you things that are happening with the coalition.
Thanks, Lena. All right. And I'm just going to cue it up to my slides. Great. Well, my name is Jennifer Troup, and as Ann mentioned, I am with the Childhood Obesity Prevention Coalition, which is a statewide group of which Seattle Children's and King County Public Health are members. And we're really committed to finding real solutions to childhood obesity. I just want to start out, there we go. If you've been listening to this webinar, then this will be pretty obvious to you, but I want to start out with a pretty basic premise, and that's that obesity is clearly a widespread epidemic of which sugary drinks are a leading cause. And a lot of times when we talk to folks about obesity, we get the response that it's a matter of individual choice. Well, the reality is that we're not just getting sugary drinks from home. We're getting them and consuming them where we live, work, learn, and play. And so everyone plays a role in this, including organizations. And we all sort of need to take ownership in terms of making healthier beverage options more available. So Public Health, Seattle and King County, and the coalition are really investing in and seeking out institutions, everyone from youth-serving organizations to businesses who want to commit to providing healthier beverage options. We really want to look for organizations who want to take a stand and take a lead in this area. And I want to apologize to folks because the Childhood Obesity Prevention Coalition website is down today, but hopefully by the time the slides go out for the webinar, it will be back up. But on our website, we have a healthy beverage checklist. And we've been shopping this around to organizations to try to get them involved in starting small or going big. And I'm going to go through a quick checklist of things that you can do. All these steps are included on this list. But before you know what you can commit to and what you need to do to improve your organization's beverage options, you really need to know where you are. And maybe not surprisingly for a number of organizations that are a little bit on the large side and have many different vendors and maybe more than one cafeteria and certainly more than one vending machine, they might not even know what they're selling and where. So start with an assessment. Look to see where your vending machines are, what your cafeterias are selling, and just get a picture of your situation. Once you've done the assessment, you can start with what I think is probably the most essential item on our checklist, which is ensuring access to tap water. So check your water fountains, check your water coolers. That might be an easy thing for you to do. That might be a cumbersome thing to do. You might find that your water fountains are old and shooting out brown water, and maybe that's why no one's drinking from them. So make sure they're working, and post signage. This is something that we used to see years ago, but we see less of now. You used to see signs to the restrooms and signs to where the water fountains are, and you don't see much of that anymore. So direct people to where they can find the water cooler and place them in a really accessible place. Don't bury it in your office. Make it readily available. And on the topic of signage, many organizations have now taken to doing a little bit of public education by posting informational posters. And I have a couple here. So the one on the left is from the Boston Public Health Commission, and the one on the right is a really enlightening one from King County Public Health, reminding folks just how sugar-filled that beverage from the vending machine is, and really causing you to think twice. So I want to take a moment because I think one of the greatest and most powerful things that you can do as an organization is to adopt a policy around beverages. I think this is a great move because it makes a statement about where your organization is and what they're willing to provide, what they're willing to purchase, and what they're willing to sell by way of healthy options. It says that this isn't just a fad for your organization. You're not stocking your vending machines with water because it's trendy, but it's a long-term commitment to providing healthy choices. So for some organizations, the policy might be, hold guard, like Seattle Children's, and for others, it might be a smaller commitment to start with. So we're going to provide at least 50% healthy options for beverages. Another step to recognize is marketing as a real and very powerful tool. And having companies like Coke or Pepsi advertise or sponsor elements of your organization usually allows in all of those enticing posters and free giveaways with their brand all over it. And of course, when we see the brands, we think about drinking those sugar-filled beverages. So if your organization is going to take that mantra of health, or if you serve youth or other groups that are unfairly targeted by marketing, you might want to consider phasing these things out. And then finally here, with any big action steps, if you're going to make a notable change like adopting a policy or adjusting your options, you want to ensure that staff and perhaps even your visitors understand why. And I think that Seattle Children's did a really exemplary job of doing that. If you're in a position of leadership and you want to make a change in your organization that affects everyone and you don't explain why, it's not going to go over well. So make sure that you're clear about that. All right. And I've just got a couple more here. So there are some tactics that you can do to make healthier options more desirable, and those are tactics commonly employed with junk food and sugary drinks. So make water more attractive, place it at eye level, and not far in the back where no one can see it. And then think about portion size. If you're selling barrels of Coke and you serve kids, then it's probably not as good news as an organization. If you have kids menus in your cafeteria, make healthy beverage the default option. Provide, this is a great one, make a commitment as an organization at your meetings and your functions to provide only healthy options. And then lastly, I just want to mention the King County Board of Health Healthy Vending Guidelines, which have already been adopted by a number of organizations. And this can be easy and this can be hard for some organizations. And when you're working with large vendors, you might not get them to cooperate on the first try. You might need to ask them a couple of times. We've had stories from organizations who have literally had to have gone down to the vending machines and unplug them because their vendor kept filling their vending machines with unhealthy options. And they wouldn't respond to their requests for healthier options. So you might need to ask a few times, and you might really need to assert your power as the organization that pays rent or owns that building. A lot of times we hear that healthy options can't be profitable. There is some data that shows that it can be, so keep that in mind. And this isn't impossible. This has been done before. You're not the first organization to do it, but you definitely don't want to be the last. And again, be very clear and transparent about your efforts. Tell your staff why you're taking steps toward healthier beverage options and tie it back to your mission. And then also, we've heard a lot from organizations that get 1 or 2 complaints, or even complaints from 5 of their 50 employees. I don't think that should be a reason to take a step back and reverse what you've done. Take that into consideration and know that you're going to get some complaints, and just walk your line and explain why you're doing what you're doing. Here's a list of the organizations that have signed our healthy beverage checklist. I just wanted to share that because you'll see that they're not all health institutions. There's businesses here and a variety of other groups. This folks can refer to after the presentation, but I just wanted to point out some of the more popular steps among those organizations that we reached out to. So ensuring access to water was an easy one, and also making healthy beverage options available at meetings was a common first step. This is a case study of another company that we included in here, so you have another example. They competitively priced water and also did some other really interesting things, so I encourage folks to read that after. And again, here are some resources. And included on here, or not included on here rather, is an organization called Healthcare Without Harm, which has a number of great resources. So when we send out the slides, I'll add that link, and then also King County Public Health website is a great place to go. And I think I'll end it there and hand it back to you, Ann.
Thank you so much, Jennifer, and thanks to all of the panelists. This has been really great information. And thanks to some of the participants who have sent in questions. We have about 10 minutes before we're scheduled to end, so I'm going to just start with some of the questions that have been sent to me, and we'll finish up in about 10 minutes. The first question is for Dr. Liu, and it concerns Mission Nutrition. We've been asked whether there's been any sort of revolution there since you implemented the changes, and generally how they've gone over with the staff and patients and families.
So we definitely, as Jennifer said, got some comments from staff and from families about the changes that we implemented. We anticipated that this would happen. I would say the bulk, definitely the bulk of the response has been, this is what our hospital should be doing. We definitely should be moving towards healthier nutrition and beverages, period. That is an overwhelming response. But on the negative side, I would say the thing that comes up, there are probably two things that come up the most. One is around artificial sweeteners. So now when you look in our vending machines, or now when you look in the cafeteria, there's, diet drinks. And I would say parents, particularly, more than staff, have been saying, why are we promoting diet drinks? When we talk to other institutions across the country about making soda and beverage changes, we actually, amongst ourselves, had sort of thought, well, maybe we should get rid of all of it, get rid of sugar-sweetened soda and diet soda, just because people are concerned about artificial sweeteners. But other institutions said they had tried that or considered it, and that was too drastic a change. So for that reason, we actually decided to just go with the sugar-sweetened beverages first. The other reason is that the FDA has not found a strong link between artificial sweeteners and health outcomes as of now, and they've been studying it for a long time. So we felt like from a health standpoint it was okay for now. But we definitely feel like Mission Nutrition is a process, and we've really tried to emphasize that to people, that this is just the first step in a very long journey that we're hoping to take to try to improve the nutrition and beverage options. The second thing I would say that people have commented on, aside from the diet drinks, is just the issue of banning it outright. Why couldn't we have left some drinks there and given people more choice? And so we're really working to expand the issue of choice. That's what people are wanting. They're wanting to have choices. And so we're really working on expanding choices for people within the categories that we're still keeping in the hospital. And obviously this is a little bit different than tobacco. When an institution bans smoking, you could no longer smoke within the building. But people, employees and families, can definitely bring drinks that they want to drink into the hospital. We're not blocking them at the door. So we did feel like there was still flexibility and choice for families who want to do that on their own.
Great, thank you so much. Another question that's come in, and I'll address this to all of the panelists, is if an organization decides to look at the drinks that it serves, does it make sense to also look at foods as well? Or does it make sense for this to be a process where an organization starts with drinks and then moves along a continuum and eventually looks at the foods that it serves?
Yeah, I'll take a quick stab at that. This is Jim from Public Health. Often the changes in beverages are the easiest ones to make because they're, for the most part, come in bottles and predetermined sizes, and it's simple as changing a contract or changing how things are stocked, whereas changing the foods that one offers, particularly if you have a cafeteria, become more complex. So it's a good place to start. However, if an institution is focusing on vending machines, then it might be just as easy to change both vending machine food as well as beverages in the first go-round. But I think it really is up to each institution to figure out what's the easiest place to start and what will be most well received to make the change gradual and acceptable to its employees or its customers or patrons.
Great. We're running out of time, so I'm going to just pass along one last question. And we have a number of small organizations that are joining us today. So one of the questions that comes in is this a reasonable thing for a small organization to take on, or do you really have to be sort of a children's hospital to do the kind of assessment of your beverage environment and make these types of policy changes? Maybe, Jen, I'll throw that one to you.
I think if you're a small organization, then you're in a lot of ways with this type of work. I think it's a lot easier to make changes when you're a smaller organization and you have a good grasp of what's being served within your four walls. We've talked to a number of smaller organizations, and things got done a lot more quickly. All of the staff were aware of what was going on. So I would say go for it, and you'll probably see results in a much shorter period of time. And maybe after sugary beverages, we'll be able to transition easily into the next level, which could be food.
Great.
I would add a quick, and that's a quick one on that, just as an example of some folks who've done that as a small organization. The health department supported some African American churches in Seattle to offer healthier beverages on site, and these churches, they had like one soda machine, and they got rid of that one soda machine and replaced it with access to water, and then they changed the policies around what kind of beverages were served at their after-school program and during church events, and that was what they did, and it was relatively easy for them to accomplish that, and it's making a big impact on their mission to make their congregation as healthy as possible.
That's great. Thank you so much, Jim, and thanks to all of our wonderful panelists and all of you who have attended today. We hope that those of you who have participated will be interested in exploring healthy beverage policies in your organizations. And in the coming week, we'll be reaching out to you to find out if we can provide you with any additional information or support. So again, thanks to everyone who participated, and have a great day.